6 hidden health dangers quietly destroying seniors. Most have no idea. As we get older, are we really tuned in to what's happening with our bodies and minds? It's a bit unsettling, but many major health problems can sneak up on us without a sound, growing quietly until they become pretty serious, sometimes even life-changing. Think about this. Did you know a silent heart attack, one with few or no obvious symptoms, can bump up the risk of stroke in older adults by almost 50%? Or that feeling chronically lonely can be as bad for your health as smoking 15 cigarettes a day? These aren't just numbers. They're real possibilities that many seniors face, often without even knowing it. Welcome today. We're going to talk about 6 of these sneaky health issues. These are the kinds of problems that can fly under the radar, affecting both your body and your mind. It's easy for seniors and even their families to brush off early subtle signs as just getting older, but knowing what to look for can make all the difference. We're not here to scare you, but to give you some really important information. Understanding these hidden dangers can help you take charge of your health, spot those early warnings, and work towards a healthier, more energetic life. We'll look at some serious physical conditions that often don't shout for attention at first, and we'll also touch on mental well-being challenges that can quietly chip away at your happiness. Let's bring these silent threats out into the open so you can better protect yourself and your future. Section 1, Silent Threat Number 1, the unseen burden of heart disease. First up is a big one often called the silent killer heart disease. It's still a major reason for serious health problems and, sadly, death among seniors. And it's the silence that makes it so risky. Many types of heart disease, like high blood pressure or the beginnings of clogged arteries, can develop for years, even decades, without you noticing a thing. You could feel completely fine while your heart and blood vessels are actually working overtime. In fact, a recent study showed that more than a quarter of folks over 60 who thought they were healthy had undiagnosed heart valve disease, with age being a key reason. Because there aren't clear warnings for many people, the first sign something's wrong is a major event, like a heart attack or stroke. Picture this. You're going about your day enjoying retirement, spending time with family, and you have no clue your heart is under stress. High blood pressure, for instance, usually doesn't give you any signs, but it's slowly damaging your arteries, heart, and other organs. Cholesterol can silently build up in your blood vessels, making it harder for blood to flow. And, as we mentioned, silent heart attacks, the kind without that classic crushing chest pain, are actually more common in older adults and can really raise the risk of a future stroke. That's where the danger is, in its sneakiness. By the time symptoms like chest pain, serious shortness of breath, or really draining tiredness become impossible to ignore, the disease might already be pretty far along. That makes treatment tougher and more urgent. This quiet progression can rob you of your energy and independence before you even know you're in trouble. Thinking no news is good news with your health can be a risky gamble, especially when it comes to your heart. So, how do you fight an enemy you can't see? The best way is to be watchful and to see your doctor regularly. Don't wait for symptoms to show up. Regular checkups are so important. This means getting your blood pressure checked routinely. It's simple, but so vital. Talk to your doctor about cholesterol and blood sugar tests too, since these are big risk factors for heart disease. Your doctor can figure out your personal risk based on your family history, lifestyle, and any other health issues you have. Lifestyle changes also make a huge difference in preventing and managing heart disease. Eating a heart-healthy diet, one that's low in saturated fats, trans fats, and salt, but full of fruits, veggies, and whole grains, is key. Getting regular physical activity, whatever your doctor says is okay for you, can really strengthen your heart and blood vessels. Even something like a brisk walk can help. If you smoke, quitting is one of the best things you can do for your heart. And learning to manage stress well, maybe through meditation or hobbies, is also a plus. Pay attention to even small changes. We all know the classic heart attack signs, but in seniors the warnings can be different, like unusual tiredness, sudden dizziness, getting short of breath during easy activities, or discomfort in your jaw, neck, or back. If you notice anything new or worrying, don't just brush it off. Talk to your doctor about it right away. Catching things early can stop small problems from turning into big ones, helping you stay healthier and more active for longer. Remember, your heart might not always yell when it's in trouble, so you need to listen closely and be its advocate. Section 2, Silent Threat Number 2, The Shadows of Social Isolation and Loneliness. Next up is a silent threat that doesn't target one organ like a typical illness, but it hits both our minds and bodies hard: social isolation and loneliness. As we get older, things change. Retirement, losing a spouse or friends, kids moving away, or maybe just not getting around as easily. All these things can mean our social circles get smaller. This drop in social contact can happen so slowly you barely notice it, especially if you live alone. What starts as just a quieter social life can turn into serious isolation sometimes, without you or even family who don't see you every day realizing it. And loneliness isn't just about being by yourself. It's that tough feeling of being disconnected, even when there are people around. The numbers are pretty serious. Studies show a lot of adults over 60 say they feel lonely. And for many, it's not just a passing feeling. It sticks around. The silent part of this threat is how sneaky it is and how much it can affect our health, often in ways we don't expect. Many seniors might not talk about feeling lonely, maybe out of pride or not wanting to bother anyone, or they just don't realize how isolated they've become. But the effects are very real. Research has clearly shown that long-term loneliness and social isolation are tied to a greater chance of high blood pressure, heart disease, and a weaker immune system. Get this, the health risks of being isolated for a long time can be like smoking 15 cigarettes a day and could raise the risk of dying early by a shocking 26% to 60%. Mentally, it's just as tough. Loneliness is a big warning sign for depression, anxiety, and serious cognitive decline. It can make existing mental health issues worse and even speed up the slide towards dementia. Imagine your spirit slowly fading, your mind not being as sharp, not because of a physical sickness, but from that quiet ache of being disconnected. This isn't just about feeling down. It's something that can really change your brain health and your overall energy, often hidden behind a brave smile or a quiet personality. When you don't have regular, meaningful social connections, you get less mental stimulation, less emotional support, and you might even slip into unhealthier habits because there's no one to share good habits with or to notice if something's off. So what can we do about social isolation and loneliness? It takes some real effort, both from seniors and from the people who care about them. First off, it's about understanding how serious this can be and realizing that needing to connect with others is totally normal. It's not a weakness. If you're a senior, try to find ways to get socially involved. Maybe join a local club, a senior center, or a volunteer group. Lots of communities have programs just for older adults, like exercise classes, book clubs, or art workshops. Even small chats, like with a neighbor or a cashier, can help. If you're okay with technology, it can be a great help. Video calls with family and friends, joining online groups with people who share your interests, or even taking online classes can help you feel connected, no matter how far away people are. And don't be afraid to reach out to your family and friends. Let them know how you're feeling. Sometimes just saying you need more contact is enough. For family members and caregivers, be proactive. Check in on your older loved ones regularly, not just a quick hi, but have a real conversation. Encourage them to join social activities and offer help if they need it, like a ride. Listen for signs of loneliness, like if they seem withdrawn, bored, or uninterested in things they used to enjoy. Sometimes just being there consistently and listening with empathy can make a huge difference. Helping them connect with other people their age can also be great. Think about community programs too, like friendly visitor services or meal delivery programs like Meals on Wheels, which often bring much-needed social contact along with a meal. Doing things that give you a sense of purpose, whether it's a hobby, mentoring someone, or a spiritual practice, can also fight off those feelings of isolation. Remember, staying socially connected isn't just a nice thing to do. It's essential for healthy aging, protecting both your mind and body from this quiet threat. Section 3, Silent Threat Number 3, the subtle creep of cognitive decline and dementia. Our third silent threat is something that understandably causes a lot of worry: cognitive decline, and when it's more serious, dementia, which includes Alzheimer's. What makes this one silent is how slowly it starts. Early shifts in memory thinking, or how we reason things out, can be super subtle. So subtle that it's easy to pass them off as just normal forgetfulness that comes with age, or maybe blame it on stress or being tired. It's pretty common for seniors, or even their families, to shrug off small memory slips, like losing keys more often, or sometimes having trouble finding the right word, as just senior moments. But these little things that don't seem like a big deal can actually be the earliest hints of something more serious happening in the brain. The line between what's normal aging and the early signs of dementia can be pretty fuzzy, which makes it tough to know when you should actually be concerned. The real sneakiness of cognitive decline is in this slow, almost invisible progression. Unlike an illness that hits you, suddenly dementia gradually wears away at your mental abilities. What starts as a bit of forgetfulness might later turn into trouble with everyday tasks like handling money or following a recipe. You might get confused about time or where you are, find it harder to solve problems, or notice changes in your mood and personality. Because these changes are often pretty mild. At first, the person experiencing them might not fully realize how much difficulty they're having, or they might try to hide it because they're scared or embarrassed. This hidden progression means that by the time the symptoms are so obvious, they can't be ignored and are really impacting daily life, the disease may have already caused significant changes in the brain. Not recognizing it sooner can mean missing out on chances for early help support and planning. It can be incredibly frustrating and worrying for the person going through it, and also for their loved ones who might be struggling to understand the changes they're seeing. It's also important to remember that connection we talked about earlier. Loneliness is a big risk factor, possibly even tripling the chances of developing dementia. This can create a tough cycle where pulling away socially because of early cognitive changes just makes the condition worse. Now, while there isn't a cure for most types of dementia, spotting it and getting a diagnosis early on is really important for a few reasons. It helps individuals and families get information, find resources, and tap into support systems. It can also help with managing symptoms, maybe even slowing things down a bit with certain medications or interventions. And it gives everyone a chance to plan for the future, both legally and financially. So what are the kinds of signs that mean it's time to talk to a doctor? We're not talking about every time you forget a name or where you put something. Instead, look for patterns or changes that are more serious or really get in the way of daily life. These might include memory loss that really messes with daily life, like forgetting things you just learned, or important dates over and over. Trouble planning or solving problems like difficulty with a familiar recipe or keeping up with bills. Difficulty finishing familiar tasks at homework or during leisure time. Getting confused about time or place. Losing track of dates, seasons, or why they walked into a room pretty often. New problems with words when speaking or writing, like having a hard time following or joining a conversation, or struggling to find common words. Misplacing things and not being able to retrace steps to find them, or putting things in odd places. Showing decreased or poor judgment, like making unusual decisions with money or not taking care of personal hygiene. Pulling back from work or social activities or losing interest in hobbies. Changes in mood and personality, like becoming easily confused, suspicious, depressed, fearful, or anxious, especially in new situations. If you see these signs in yourself or someone you care about, try not to panic, but definitely don't ignore them. Make an appointment with a doctor. A healthcare professional can do some cognitive checks, rule out other things that might be causing the symptoms like vitamin deficiencies or medication side effects, and if needed, refer you to a specialist. Lifestyle choices also matter for keeping your brain healthy. Doing things that stimulate your mind, like reading puzzles, learning new things, staying socially active, and getting regular physical exercise are all good for your brain. A balanced diet, getting enough good sleep, and managing risks for heart disease like high blood pressure are also important. By being aware of those subtle early signs and taking action, we can better handle the challenges of cognitive decline and get support when it's needed. Section 4. Silent threat number 4. The under-recognized weight of depression. Our fourth silent threat is something we really need to talk more about: depression. While it can hit anyone at any age, depression in seniors often gets misdiagnosed, or just brushed off as a normal part of getting older, a natural reaction to loss, or something that comes with physical illness. That's a dangerous way to think. Depression isn't a sign of weakness or a flaw in your character. It's a medical condition that can be treated. The silence around depression in older adults often happens for a few reasons. Symptoms can look different than they do in younger folks. For instance, sadness might not be the main thing they feel. Instead, seniors might feel irritable, have no interest in anything, experience unexplained aches and pains, or just lose interest in life and activities they used to love. Plus, older adults might be less likely to open up about their feelings or ask for help because of stigma, feeling like they should just tough it out, or simply not realizing that what they're feeling is actually depression. When depression in seniors goes unrecognized and untreated, the fallout can be truly devastating, quietly eating away at their quality of life and overall health. It can make other medical conditions worse, leading to a decline in physical health. For example, adults with depression have a much higher risk of developing heart disease. It can mess with cognitive function, sometimes looking like or even worsening symptoms of dementia. Depression can also lead to pulling away from others, making those feelings of loneliness and isolation even deeper. And as we've talked about, those bring their own serious health risks. It can zap energy, lead to neglecting personal care, poor eating habits, and sleep problems. Maybe the most alarming thing is that untreated depression in older adults is a huge risk factor for suicide. Feelings of hopelessness, worthlessness, or feeling like a burden can become just too much to handle. The silence around their emotional pain, not having an outlet, or anyone recognizing what they're going through, can make these feelings even stronger and more unbearable. When physical health problems are also in the picture, it's all too easy for both the senior and their doctors to focus only on the physical symptoms, leaving the underlying depression to just sit there and grow, affecting every part of their life. This hidden suffering is a real tragedy because in so many cases, there's good treatment out there. Recognizing depression in seniors is the absolute first and most important step. It's key to understand that symptoms can be subtle or not what you'd typically expect. Be on the lookout for ongoing feelings of sadness, hopelessness, emptiness, or anxiety. Losing interest or pleasure in hobbies and activities they used to enjoy? This is sometimes called anhedonia. Unexplained tiredness, lack of energy, or feeling slowed down. Sleep problems, either trouble sleeping, waking up super early, or sleeping way too much. Changes in appetite, eating too much or not enough, leading to weight changes. Trouble concentrating, remembering details, or making decisions. Being more irritable, restless, or agitated than usual. Feelings of worthlessness, guilt, or helplessness. Ongoing physical symptoms that don't get better with treatment, like aches, pains, headaches, or digestive issues. Pulling away from social situations and becoming isolated. Thoughts of death or suicide. If anyone mentions this, take it very seriously and get professional help right away. If you see these signs in yourself or someone you care about, it's so important to reach out for help. Start by talking to a doctor. They can screen for depression and rule out any other medical conditions or medication side effects that might be causing the symptoms. Depression is often treated with a mix of therapy, like cognitive behavioral therapy, or just talk therapy medication, or both. Lifestyle changes can also make a real difference. Regular physical activity, a healthy diet, getting enough sleep, and getting involved in social activities can all help lift your mood. Cutting down on social isolation is huge. Encouraging connection with family, friends, and community groups can give that essential emotional support. Remember, admitting that depression might be an issue and asking for help is a sign of strength, not weakness. It's about getting back joy, purpose, and well-being in your later years. Section 5. Silent threat number 5. The unspoken agony of chronic pain. Our 5th silent health threat is something that a huge number of seniors deal with. Yet it often doesn't get talked about or treated enough: chronic pain. This isn't just a temporary ache from a minor injury. Chronic pain is discomfort that sticks around for more than 3 months, sometimes for years. It can come from conditions like arthritis, nerve damage, often from diabetes called neuropathy, osteoporosis, old injuries, or pain after surgery. The silence around chronic pain happens for a few reasons. Many seniors wrongly think that constant pain is just something they have to put up with as they get older, that it's unavoidable. They might hesitate to tell their doctors about it, afraid of being seen as complainers, or they might worry about the side effects of pain medicine. Sometimes, if there are communication problems or cognitive issues, it can also be hard for seniors to explain their pain clearly. When chronic pain isn't managed, its impact is huge and incredibly damaging, quietly taking away a senior's quality of life. It's not just about the physical feeling of hurting. Chronic pain can kick off a whole bunch of other problems. Getting around often becomes really difficult, making it hard to do daily chores, enjoy hobbies, or even leave the house. This can lead straight to pulling away from others and feeling isolated, because keeping up with friends or going to social events just becomes too hard or painful. The constant fight with pain is draining both emotionally and mentally. It's a major reason for depression, anxiety, and sleep problems. Imagine trying to find any joy in your day when every move is a struggle, or trying to get a good night's sleep when pain keeps waking you up. This can create a nasty cycle. Pain makes your mood worse, and a low mood can actually make the pain feel even stronger. Chronic pain can also affect appetite, lead to getting out of shape from not moving much, and raise the risk of falls if it causes unsteadiness or weakness. Silently putting up with pain because of that mistaken idea that it's just part of aging stops many seniors from looking for relief and basically sentences them to a life with less ability and less joy. This hidden burden doesn't just affect the person in pain. It can also put a lot of stress on caregivers and family members. The most important thing to take away here is that chronic pain is not something you just have to live with. There are effective ways to manage pain. The very first step is to speak up. If you're dealing with ongoing pain, talk about it openly and honestly with your doctor. Don't downplay how you're feeling. It might even help to keep a pain diary. Write down when the pain happens, what it feels like, what makes it better or worse, and how it affects your daily life. This kind of information can be really useful for your doctor. Getting a thorough pain assessment from a healthcare professional is key to figuring out what's causing the pain and coming up with the right treatment plan. This plan often uses several different approaches at once, what doctors call multimodal. Medications can help. These can range from over-the-counter pain relievers like acetaminophen or ibuprofen, but use these carefully to avoid side effects, to prescription medicines for more severe pain, including treatments for nerve pain, or in some situations opioids but only under strict medical supervision. However, strategies that don't involve medication are just as important, if not more so, for managing pain long-term. Physical therapy can be incredibly helpful, improving strength, flexibility, and movement through exercises designed just for you. Gentle exercises like Tai Chi yoga or water aerobics can reduce stiffness and improve how you function without putting too much strain on your joints. Other therapies that might help include heat and cold therapy. Using heat can relax muscles, while cold packs can bring down swelling and inflammation. Cognitive behavioral therapy, CBT. This helps people develop ways to cope by changing how they think about and react to pain. Mindfulness and relaxation techniques. Things like meditation and deep breathing exercises can reduce stress and make you less sensitive to pain. Alternative therapies. Some people find relief with acupuncture or massage therapy. Lifestyle adjustments. Keeping a healthy weight, eating a diet that fights inflammation, and making sure you get good quality sleep can all affect pain levels. It's all about finding the right mix of strategies that works for you. Don't give up if the first thing you try doesn't give you enough relief. Work with your healthcare team to explore different options. Managing chronic pain effectively can make a huge difference in your ability to move your mood and your overall enjoyment of life. You deserve to live with less pain. Section 6. Silent threat number 6. The quiet weakening of the immune system and hidden infections. Our final silent threat looks at our body's defense team, the immune system, and how it can get weaker as we age, a process sometimes called immunosenescence. As we get older, our immune system naturally doesn't work quite as well or react as quickly to threats like bacteria and viruses. This makes seniors more likely to get infections like pneumonia, the flu, urinary tract, infections, UTIs, and skin infections. The silent part of this threat works in two ways. First, the weakening of the immune system itself is a slow internal thing that you can't see from the outside. Second, and this is perhaps even more critical, when older adults do get infections, they often don't show those classic, obvious symptoms that younger people get. For instance, a UTI might not cause that burning pain when you urinate, but instead it might show up as confusion, agitation, or suddenly not being able to control your bladder. Pneumonia might not always come with a high fever or a bad cough, but maybe just weakness or dizziness. This mix of a sneakily weakening defense system and unusual, often subtle infection symptoms creates a really dangerous situation. An infection that might just be a bother for a younger person can quickly become severe, even life-threatening for an older adult whose immune system is already not at its best. Because those early signs are easily missed or blamed on other conditions or just getting old. Getting diagnosed and treated can be delayed. This delay lets the infection get worse, possibly leading to serious problems like sepsis, needing to go to the hospital, long-term disability, or even worse. Think about how social isolation plays into this too. Research shows that being socially isolated can actually weaken the immune system even more, making you more vulnerable to getting sick. So, a senior who is already a bit isolated might have a less tough immune system and also fewer people around to notice those subtle early signs of an infection. On top of that, chronic conditions that are common in seniors like diabetes or heart disease can also hurt immune function and make it harder for the body to fight off infections. This quiet vulnerability means that seniors are often fighting off invaders without all the defenses they had when they were younger, and sometimes nobody even realizes the fight has started until it's a real emergency. Protecting yourself from this silent threat means taking a proactive, multi-step approach, boosting your immune system as much as you can, and being on the lookout for unusual signs of infection are both key. First off, vaccinations are incredibly important. Keep up to date on all the recommended shots, including the annual flu shot. There are high-dose versions often recommended for seniors, pneumonia vaccines, the shingles vaccine, and more recently, RSV vaccines, if your doctor says they're right for you. These vaccines help get your immune system ready to fight off specific bugs. Lifestyle choices also play a big part in keeping your immune system strong. Nutrition. Eating a balanced diet full of fruits, vegetables, lean proteins, and whole grains gives you the essential vitamins and minerals your immune system needs. Foods rich in probiotics like yogurt might also help your gut health, which is closely tied to immunity. Regular exercise. Moderate physical activity gets your circulation going, which helps immune cells find and fight infections more effectively. Enough sleep. Getting good quality sleep is vital for your immune system. Try to stick to a regular sleep schedule in a dark, quiet room. Stress management, chronic stress, can weaken your immune system. Make time for stress-reducing activities you enjoy. Hydration. Staying well hydrated is important for your overall health, and that includes your immune function. Good hygiene. Simple things like washing your hands often, especially after being in public or before you eat, can stop germs from spreading. Just as important is paying attention to subtle or unusual changes in your health or behavior, as these could be early signs of an infection in an older adult. Don't just dismiss sudden confusion, increased tiredness, loss of appetite, dizziness, unexplained falls, or a new problem with bladder control. If you're a caregiver, keep an eye out for these changes in your loved one. Tell a healthcare provider right away about any symptoms that worry you. Catching and treating infections early can make a huge difference in how things turn out, stopping minor problems from turning into serious health crises. Taking these proactive steps can help strengthen your body's defenses and keep you healthier as you age. So let's quickly recap the 6 significant silent health threats we've talked about today. 1. The unseen burden of heart disease, which can brew without symptoms until a major event. 2. The shadows of social isolation and loneliness, which deeply affect both mental and physical health. 3. The subtle creep of cognitive decline and dementia, where early signs often get mistaken for normal aging. 4. The under-recognized weight of depression, where symptoms in seniors can be different and easily missed. 5. The unspoken agony of chronic pain, often endured silently with the thought that it's just part of getting older. 6. The quiet weakening of the immune system and hidden infections, where illnesses might show up with subtle signs and get serious quickly. Every one of these threats has something in common. They can develop quietly without big, obvious warnings. But as we've discussed, being aware is your best first step. Knowing that these conditions can be silent helps you be more proactive, more observant, and more empowered when it comes to your health. Remember, those subtle changes can sometimes be really important signals. Your health is truly your most valuable asset. If anything we've talked about today hits home for you, or if you have any concerns about your own health or the health of an older loved one, please don't hesitate to make an appointment to talk with your doctor or another qualified healthcare professional. They're your best source for personalized advice, screening, and treatment. Starting those conversations early can lead to early detection and better results. If you found this information helpful, we'd appreciate it if you'd give this video a like. It really helps other people find it. And please feel free to share this video with other seniors, family members, and caregivers who you think could benefit from this knowledge. For more tips and insights on aging, well, go ahead and subscribe to our channel. We'd also love to hear from you in the comments below. Which of these silent threats surprised you the most? Or is there a health topic you'd like us to cover in a future video? Living a long and healthy life means being an active player in your own well-being. By understanding these silent health threats, you're much better prepared to listen to your body, speak up for your needs, and take steps to prevent problems. Don't let silence get in the way of your health. Stay informed, stay proactive, and please take good care. Thanks so much for watching.